Hello, I'm Dr. Penziner-Bokde, a member of the Twin Cities Medical Society and a proud supporter of Minnesotans for a smoke-free generation and its week of action. Thanks to so many of you, Minnesota has already been a leader in fighting against the harms of tobacco in our state. But we still have work to do. I'm so excited for the momentum we'll bring this year to create a healthier state for each and every Minnesotan without exception. Our issues this year are especially important to me as a pediatrician. Minnesota should end the sale of menthol and all flavored tobacco products to keep kids healthy and advance racial and health equity. We know that big tobacco uses flavors to mask the harshness of tobacco and uses these alluring flavors to target Black Americans, the LGBT community, American Indians, and other groups. As a pediatrician, knowing that younger and younger Minnesotans use flavored e-cigarettes is beyond concerning. 80% of our youth who use tobacco started with a flavored product. And the e-cigarette epidemic has erased 2 decades of progress in decreasing youth tobacco rates. We need an all-hands-on-deck approach to protecting Minnesota youth from lifelong tobacco addiction. We also have an opportunity this year to remove barriers to tobacco cessation services for Minnesotans who rely on Medicaid and Minnesota Care. The Minnesotans on public programs like these are twice as likely to use tobacco than individuals who aren't on these programs, and it's time that we remove barriers to ensure that each and every Minnesotan can access the FDA-approved cessation medications and counseling services. Removing these barriers would also help support Minnesotans living with mental illnesses or substance use disorders as well. These individuals are more dependent on tobacco, smoke more heavily, and are more likely to die from tobacco-related illness than from their mental health or substance use conditions. We can support them by expanding what providers can be reimbursed for the tobacco treatment support they give. Minnesotans can get their tobacco support services from all providers that are trained to give it, whether that is from a doctor's office, a drug and alcohol counselor, or a community health worker. We can stand up to big tobacco by ending the sale once and for all of flavored tobacco products and remove barriers to cessation services for Minnesotans. I am so thankful to be an ally in this work with each and every one of you. Let's build lawmaker support for these important, impactful policies that can improve the health of our state. Together we can do this. Thank you.